this video, let us see about electrolyte disturbances. This may happen because of overconsumption of the drug or toxicity. These electrolytes are elements and compounds that occur naturally in the body. They control important physiological functions. Say example of various electrolyte include calcium, chloride, magnesium, phosphate. But many times the drug can alter calcium, and then potassium and sodium level in the body. So we will be dealing with this. These substances are present in the blood, body fluids and in urine. When they are ingested with food, drinks and other supplements. So an electrolyte disorder occur when the level of electrolyte in the body, either it will be too high or too low. So these electrolyte need to be maintained even in a balance in order to show the proper function of the body. Severe electrolyte imbalance can cause several problems which include coma, seizure and cardiac arrest also. Some of the symptoms generally we can enlist because of electrolyte disorder, like irregularity in the heartbeat, fast heartbeat, fatigue, lethargy, convulsions, nausea, vomiting, diarrhea, constipation, abdominal cramping, muscle weakness, irritability, confusion, headaches, numbness and tingling. These are commonly we can come across. Let us start with the potassium. This potassium is particularly important for regulating heart function. It also helps to maintain healthy nerves and muscles. So the condition hyperkalemia may develop due to high level of potassium. So this condition may be fatal if undiagnosed and treated. It's typically get triggered by severe diarrhea condition like dehydration, certain diseases like kidney failure, diabetic ketoacidosis, high blood pressure, adrenaline deficiency, and many of the drugs can cause in higher dose this hyperkalemia like digitalis, beta 2 antagonist, potassium sparing diuretics, NSAIDs, fluorides, heparin, succinylcholine, drug producing acidosis. So the main complication or manifestations which include pain, diarrhea, myalgia, weakness, then ECG changes can be observed. So ventricular fibrillation can be seen with the patient. Now the treatment which includes administration of glucose, insulin infusions can be done, sodium bicarbonate, calcium gluconate can be given, and even hemodialysis can be preferred, and even some exchange resins can be administered so that it can overcome the situation. So next is the hypokalemic condition, where the potassium level will be less than the normal. The potassium level, if it is less than 3.5 milliequivalent per liter, so this is called as hypokalemia condition. Even many agents like beta 2 agonist, theophylline, insulin, chloroquine, caffeine, dextrose, loop diuretics, thiazide diuretics, oral hypoglycemics, salicylates, sympathomimetics, drug-induced gastroenteritis, and even metabolic acidosis causes hypokalemia condition. Then coming with the manifestations of hypokalemia, muscle weakness can be seen, paralytic illness, ECG changes, and severe cases of AV blockage and ventricular fibrillation can be done. The treatment here includes oral or IV potassium salts can be given as a supplement to overcome the situation. Then coming with the second electrolyte, sodium. The sodium is necessary for the body to maintain fluid balance, and it is critical for normal body function. It also helps to regulate nerve functions and muscle contraction. Severe increase in the level of sodium can cause the condition called as hypernatremia, where the sodium level is more than 150 milliequivalent per liter. So now, because of many reasons, so this hypernatremia may happen, like inadequate water consumption may be the general reason, up to severe diarrhea, vomiting, sweating, respiratory illness, and administration of many of the drug like colchicine, lithium, propaxifene, rifampicin, phenytoin, alcohol, mannitol, sorbitol, sodium salts, excess water loss, IV saline solution, salt, emetics, various corticosteroids. So they can cause this hypernatremic condition. Now the treatment which include water replacement with or without loop diuretics. So then let us move on to the next, that is the hypernatremia condition. The word hypo represents decrease in the sodium level, then less than 130 milliequivalent per liter. So this hyponatremia it may develops because there will be less sodium. So now various reasons we can include over here, like excessive fluid loss from skin or some burns, it may be, or some vomiting, diarrhea, or even some poor nutrition, and alcohol consumption as a general we can consider. Many of the diseases like liver, heart disease, kidney failure, so it may cause this hyponatremia, and many of the medication as a side effect or toxicity can cause this hyponatremia. The drugs like carbamazepine, chloropropamide, NSAIDs, amitriptyline, biguanides, sulfonylureas, captopril, AC inhibitors, lithium, imipramine, oxytocin, excessive water intake. So these are the conditions which can cause hyponatremia condition. Treatment like we can give hypertonics, saline to overcome this situation. So next it may be the calcium. Now coming with the calcium, calcium is a vital mineral that the body uses it to stabilize blood pressure and control skeletal muscle contraction. Even it is used to build strong bones as well as the teeth. Some of the situation which can be observed during abnormalities, which includes hypercalcemia, where calcium level will be less than 4 milliequivalent per liter. So this is a hypocalcemia condition. So this hypocalcemia condition may happen because of kidney failure, hypoparathyroidism, vitamin deficiency, and even malnutrition, and even many drug induced like administration of hydrogen fluoride, oxalate, aminoglycosides, ethanol, phenobarbital, phenytoin, thiophyllene, ethylene glycol can cause decrease in the calcium level. So now the treatment, which includes administration of calcium gluconate through IV route, 10% solution of 10 ml slowly at a time, it should be administered. So it can be observed like drug induced hypercalcemia during administration of concurrent drugs, that should be taken care while administering excess calcium in a person. So next, let us move on to treating this electrolyte disorder. How generally these electrolyte disorders can be treated. This treatment may varies depending on the type of the electrolyte disorders and many of the conditions which can cause it. So in generally certain treatment can be given which can restore or proper the balance of minerals in the body, which include IV fluids. Intravenous fluids can be administered. So typically sodium chloride can be administered, which can rehydrate the body. It is commonly used in the case of dehydration, which may result from vomiting, diarrhea, or many times drug-induced dehydration. Even electrolyte supplements can be added to IV fluids to correct the deficiencies. Even certain IV medications can also help the body to restore electrolyte balance very quickly, and even it can protect from the negative effects which can be seen during the situation. So the medication which can be administered, which include calcium gluconate, magnesium chloride and potassium chloride. So in the deficiency condition, it can be included in the saline, it can be administered. Then oral medication and other supplements can also be administered. That depends on the responsiveness of the patient and the situation of the patient. Certain oral medications or oral rehydration solutions can be administered to correct the chronic mineral abnormalities. Such supplements which includes calcium, this calcium can be administered in the form of calcium gluconate or calcium carbonate or calcium citrate or calcium lactate. When magnesium deficiency, magnesium oxide can be given, and potassium deficiency in hypokalemia condition, potassium chloride can be administered. This is how generally we are going to maintain the electrolyte imbalance by administering IV fluids, whereby we can protect the body, because as we have known, these electrolytes plays a very vital role in regulating various physiological aspects of the body. So abnormalities may happen because of the overconsumption of certain drugs. Drug toxicity as a commonly it decreases the electrolyte level. So this is about the evaluation in the general management of poisoning. So these evaluation steps what we have discussed up to now. So it should be tried with the patient if no crisis have been observed with him, and if he is alert and normal, speech and pulse is observed, and we can go with the complete thorough systematic examination such that the treatment can be given to the patient. So in the next video I will be updating about the next principle involved in the general management of poisoning, that is the decontamination. So up to now we had covered stabilization principle which is involved in the general management of poisoning, and we have covered various evaluation of abnormalities which can be observed during the poisoning. Let us discuss about the decontamination, which plays a major role in removing the poison or preventing the absorption of the poison. So in the next class I will be uploading a video related to the decontamination. Thank you.